Where you at in the world? I'm Sergeant First Class Johnson, and today we have a very, very special episode of Sick Call featuring Dr. David Flick. For those of you who don't know, Dr. Flick is a family medicine physician in the U.S. Army. He used to be active duty Army, but he's transitioned now to the U.S. Army Reserves. Dr. Flick also is a former admissions committee member and a graduate of UCIS School of Medicine. He's also the Associate Director of Advising at MedSchoolCoach.com. He's coming to us today from sunny San Diego, loosely San Diego. Without further ado, sir, I turn it over to you.
Hey guys, welcome. So thank you for the introduction. So yeah, I wear a couple of different hats. So I recently got off active duty, still in the reserves right now, do some work to kind of help pre-meds, like hopefully yourself who's listening in, get that letter of acceptance and start your career in medicine. So yeah, quick background to hopefully lend some clout to the things that we're going to talk about today is I spent 4 years on the admissions committee at UC Irvine, including the selections committee. And then my civilian job, besides doing clinical work, is I'm a professional pre-med counselor. So I help people get into medical school. So this episode, I want to talk to you guys about something that's kind of important that maybe you guys have thought about or interested about. But this is going to be an episode all about DO, so all about osteopathic medicine. So we're going to cover a lot of different things here, but in true Army fashion, I want to tell you what I'm going to talk about. We're going to talk about it, and I'm going to tell you what I told you. So just to keep on track, I want to talk about what is osteopathic medicine, who should apply to osteopathic medical schools, why you should be applying to osteopathic medical schools, and then how to get it done. So let's frame the conversation by first talking about what's the difference between a DO and an MD. And the bottom line up front is there is no difference. And so there's two different letters behind your name, but practically speaking, DOs and MDs do all the same stuff. So anecdotally speaking, as a family physician, I refer to DOs in every specialty from family medicine, plastic surgery, cardiothoracic surgery. So that should serve to kind of discount the main myth that DOs have different opportunities than MDs. And so I can tell you that doesn't really exist. Is that I tell people this all the time, is that the only indicator or the only measure that determines what you do in your career in medicine is your performance in medical school. So it doesn't matter if you go to an MD school or a DO school. It doesn't matter if you go to Harvard Medical School or your state school, okay? The only thing that matters is how you perform there, okay? So I want to just kind of dismiss up front the idea that, well, DOs have different opportunities than MDs. So with that being said, then let's talk about, well, what are DOs? And full disclosure is I'm an MD myself, but work with lots of DOs and certainly work with lots of DO applicants too. So what is a doctor of osteopathy and how is their education different from MD? Well, MDs learn everything that DOs learn and vice versa, except DOs do some manipulative therapy or some hands-on stuff. That's called osteopathy. Now, most DOs would not like to be compared to a chiropractor, but for intensive purposes, I think it's useful for people unfamiliar with those techniques to kind of understand it's hands-on manipulation of the body, somewhat similar to what you may have experienced if you've ever worked with a chiropractor or a physical therapist. Now, there's some things called the tenets of osteopathic medicine. These are some core principles of what osteopathic medicine basically puts out to the public about how they're different. I'm not going to go over those tenets, but I want you to Google them later today. Tenets of osteopathic medicine is important for every applicant to understand, and we'll get more into that when it comes to how to apply to osteopathic schools. So DOs do the same 4 years that an MD does, 2 years of pre-clinical medicine where you're studying in the classroom, 2 more years of clinical medicine when you rotate in the hospital, off to your specialty training. Mixed into that, they're doing some work with basically learning how to do some of these hands-on techniques to help facilitate healing in the body. So, okay, so hopefully you got at least this is like a 30,000 foot view of what DO medicine is. Certainly if you want to spend more time learning about the intricacies of it, head to the American College of Osteopathic Medicine's website or just Google what is a DO and you'll find more about some of the specifics. But what I want to leave you with is that from a practical standpoint, DOs and MDs are doing the same thing. So if that's what the difference is, or rather the similarity is, well, then let's talk a little bit about, let's kind of, I want to talk about some of maybe like, think of like the FAQs of applying to DO medicine. I'm going to pull up a little bit of some of the questions that the recruiters have kind of put out there, which I think are good questions that a lot of people are asking. So the first question is, well, what is the difference between DOs and MDs, let's say, in the Army, since we're talking about, you know, the HPSV, or Health Profession Scholarship Program? And the answer is there's no difference, is that DOs are doing just what MDs are doing in the civilian sector and also in the Army or military sector too, which serves 2 points. One is to understand that, well, you're not going to have a different pathway based on those 2 letters behind your name compared to some of your peers. But that's also important too, because especially in the military, you may find that DOs have maybe a little bit of an increased opportunity. And I don't really have any kind of good reason why or some logic behind this, but anecdotally speaking, there's just a lot more DOs, certainly in my experience in the medical field with the military. So if anything, I would say, at least anecdotally speaking, that maybe DOs in the Army have a couple more opportunities, and that may just be to how many DO applicants come into HPSV. But I'll just put it out there that DOs are basically going to have the same opportunities, maybe even a little bit more, in terms of just there's a higher percentage of them in the Army, at least in my experience. How about stuff for, you know, that's talking about clinical practice and things like that, but how about any difference in getting selected for positions, leadership roles, promotion potential? Nothing. Okay. Again, just like in the clinical world, how the only thing that determines your success in your medical career depends on your performance, same thing in the Army. The only thing that's going to determine your promotion potential, your leadership potential, is how you interact with people in the Army, how you actually do your job and your performance, stuff like that. How about some other questions like, is there a pay difference between the two in the Army and civilian sector? Absolutely not. So the only thing that's going to determine your pay is going to be things like, well, your specialty, okay? So family medicine doctors like me don't make as much as a general surgeon or an anesthesiologist. People that are in rural areas actually tend to make a little bit more than those in the big cities, just because there's a lower percentage of people to draw from the workforce. But none of that has anything to do with the last 2 letters in the name. How about the benefit in the varying education track? So I don't necessarily think that MDs are going to get a better education than DOs or vice versa. I think an interesting point to bring up is, well, then how do you actually decide what kind of medical school you want to go to? Or how do you decide what medical school to go to in general, whether it's, you know, choosing from MD schools or choosing from DO schools or comparing back and forth? I don't want to spend a ton of time, because I could probably do a whole hour on how do you actually make a decision on what medical school to go to. But what I do want to leave you with is that, kind of like what I said before about the only thing that determines your success is your performance. The right medical school for you is not the ranking of the school. It's not the prestige of the school. It's certainly not whether it's MD or DO. It's the school where you're going to thrive the best. Okay, that might be at Harvard. That might be at Alabama State Medical. Okay, it depends on where you're going to thrive. Location, the patient population that you're working with, your familiarity with the area, the support system that you have. Those are the things that are going to allow you to succeed in medical school and eventually achieve your goals. So whether you're choosing, well, should I do MD or DO, I would focus less on the name of the school, less on the last 2 letters you're getting, and more on give it more of a holistic approach of what works best for you. Okay, so let's take a pause from some of those questions. Hopefully that's at least generating at least some conversation. There's some people that are joining in here with us, you know, on the call as well as live too. I'm talking a lot. I just want to take a quick pause to see if anybody's got any questions so far, certainly from the live audience or you guys that are joining us from LA too. Any questions so far?
That's perfect, sir. Yeah, we do actually have one from one of our YouTube guests. Ms. Cheyenne Tate would like to know if there are any specialties that the Army prefers.
That's a good question. I think what's kind of underlying that question too, and I'll tell you that no, the Army doesn't have any preference on specialty. They stay out of your medical education. And again, the only things that's going to determine what you actually go into is what you want to go into and what you end up performing at the level to get into. Okay, so The more competitive the specialty, like the vascular surgery or plastic surgery, you're going to have to perform real well to get there. So it's your performance and your interests that are going to get you in that specialty. The Army doesn't really have a preference on what you do. The Army does have a set amount of specialties that exist, so that graduate medical education. And what I will do is quickly and happily plug the Army. If you're thinking about HPSP, Army versus Navy versus Air Force, is, honestly, I don't really have any specific. I mean, I enjoyed my time in the Army and I still do as a reservist, but I'm not tied to that branch. Is that the Army has the largest graduate medical education branch, which means more funding, more programs. You're more likely to track like your civilian peers and get into the program that you want to go to. If you're going to be in the Navy or the Air Force, nobody's going to be pressuring you to go into any one specialty. But hey, there just might not be that many slots for something like orthopedic surgery. There's going to be more slots in the Army. You're going to be more likely to get that position if you choose to go through them. So hopefully, that was a long-winded response to the question, but hopefully that answers that.
I think that was perfect, sir.
Cool. Other questions so far right now?
Sir, I actually had a question too that I was texted to. This person asks, can you tell us about your experience in med school while you were receiving a scholarship?
Yeah, I think that's a big black box for a lot of applicants. Like, am I going to be like wearing a uniform and kicking down doors or in training or what's going on? So, I'll be honest, I was kind of had a lot of trepidation about that because I didn't know anybody in the program when I went in. And so your civilian education, that's like the beauty of HPSP versus something like going to USUS, which is the Uniform Service University, basically active duty medical school. If you go to USUS, you're going to be wearing a uniform. You're going to have a military curriculum. Your education is going to be a little bit different than your civilian peers, but not through HPSP. That's kind of the whole point. You get to pick where you go to medical school, and you get to do your thing alongside your peers. So nobody would have known that I was in HPSP unless I told them. Most people knew because I think I had a nicer apartment than some people because I had that stipend to pay, maybe going out to dinner a little bit more than my peers, but you do everything like your peers do. So you're not wearing a uniform. You're dressed like everybody else. I went to UC Irvine. I showed up to class in board shorts and a t-shirt every day. I had a big old beard in medical school. So you're going to be basically uninterrupted, go to school the way you normally do. Nobody's pulling you out for deployments or anything else. You do have the extra opportunity during your first summer break in between first and second year. You could go use that break to do something like research or some kind of shadowing or experience with the military, which is pretty cool. You'll also have the opportunity to do that in second and third year, although most people don't have a break. And so you just get a letter in the mail that says, like, keep going to school, great job. And then in third and fourth year, when you're going to be interviewing for residency positions, the Army actually pays you to go do that, which is pretty cool. So I went up to Washington State. I flew out to Hawaii, full expenses paid trip, which is pretty nice. Stay for 45 days. You get paid, you get a car, you get a hotel. And so you basically get paid to go interview and experience some of those programs. So little extra perks, but otherwise, it's business as usual. You're going to be the same as your civilian peers. It's a great question. What else we got?
I have a question, sir, if I may.
Yeah, please.
So thank you for that introduction, and I liked loved your definition actually of osteopathic medicine, since that was something that connected with me as well. So that was my my journey is going to be going to DO school soon in the summer. So appreciate that introduction on that. So my name is Sean Donnelly. So I'm also an applicant for the HPSP scholarship, and my question stems from maybe just asking you and seeing your thoughts. Or I'm prior service. So served in the Army, enlisted side back in 2010 and 2013.
Cool.
And this was kind of asking, how do you, anticipate the transition from enlisted soldier to, to officer side, and then as well as, being a medical doctor versus, for example, I was ex-infantry 11 Bravo. So
nice.
Please give me some insight on that. That would be awesome for anybody else.
For sure. I think that's really cool. And so I think for the listeners out there, if you're prior service, thank you for your service. That's awesome. It's going to help you a ton as an HPSB student, and then as you go into your active duty career. If you're not prior service, don't worry. I never had seen the light of day for the military beforehand. I did just fine. But you're going to be a huge asset to the Army as well as to your peers too. And so have you done BOLIC yet, your basic officer leadership course?
I have not, no sir.
So get ready for this. So you're going to go there. And by the way, it is nothing like what you experienced as an enlisted soldier, which is a good chance to say, number one, a lot of people are nervous that have never been in the Army, especially this came from my parents. They're like, oh my goodness, you're going to go to boot camp. There's going to be somebody screaming in your face like what they see on the movies. That may have been your experience as an enlisted soldier. That is not going to be your experience in the Army. So I like to tell this story, like, I don't know, maybe this, well, no, it is fine. So, you know, when you go to BOLIC, like everybody doesn't know what they're going to get into. And some people actually do have this like fear that you're going to be like in boot camp, you know, as like a brand new recruit. I mean, you enter as a second lieutenant, okay? So you immediately outrank every enlisted soldier that's there. That doesn't mean that they don't have the much more knowledge than you'll ever have about the Army, but that does mean that in the Army that, you know, enlisted soldiers owe a certain respect to the rank that you wear. And so nobody's going to be yelling at you. Our first sergeant gave us a pretty hard day, like the first day. And then the next day he was like making sure we had enough water and keeping hydrated, making sure we were okay. But so when you get to BOLIC, you are going to be like the star of the show. They're going to say, who here has prior service? Raise your hand. Please come help us out up front, because all these brand new guys, these brand new second lieutenants don't have a clue what it means to even stand at attention, let alone wear their uniform right. So you're going to be a huge asset to basically help these people know how to arm and figure it out. So plus you got that stuff up front, so you're not going to be as nervous as everybody else and wondering, who do I salute and who do I not salute? I got to be honest with you, there's all these Navy guys at the base where I was at, and I thought their little rank there was, everybody's a colonel. I mean, the Navy uniform looks like, I mean, these guys are like 19 years old. Everybody's like an 06. You're going to help people like me figure out the system a lot quicker. And it's just going to basically allow you to move through your career not having to worry so much about, you know, the basics of how to get the job done in uniform. Well, sorry, that was also a very long response, but it's going to be to your advantage for sure. And then if you ever go into, you know, operational medicine where you're working with a unit, you're going to have a lot of respect from the other 11 Bravos out there that are like, oh, shoot, my doc was one of me, man. You're going to get a lot of street credit just from that alone.
That's good to hear. I'm glad all that paid off for me. So hopefully in the long run. But I think thank you so much for answering that question.
Oh, for sure.
Appreciate it.
Yeah. Well, let me pause on the questions and try to circle back to, I think we may have got a little sidetracked. I'm having too much fun. But so we talked a little bit about like, what is osteopathic medicine? How is it different? How is it really the same? So let's talk a little bit about why you should be applying to osteopathic medicine. And this is something kind of near and dear to my heart as a pre-medical admissions advisor, is that this is an untapped resource for most applicants. And what I'm going to do is I'm going to bore you guys with just a little bit of data. So I'm going to pull up my screen real quick because I want to show you this MCAT grid. This is something that you can access, you know, if you just Google it. But let me pull open this tab real quick. And I want to show you some data here about, you guys see my screen okay?
It's
Nothing yet. There we go.
Beautiful. So I know this is probably pretty small on your screen, so feel free to stare very closely or, you know, come back to this. But if you just Google MCAT GPA grid, this is something that the AAMC, you know, MD admissions publishes every single year. And what I want to draw your attention to is if you look at the top of the screen up here is MCAT score. On the side, you can drag down to GPA. And what I want to show you is, okay, 3.7 is about the average GPA for a matriculant to MD schools nationwide. So we're going to start with that 3.7 and drag it across to the 510, 513 MCAT score. And that shows you that that's the national average only about 60% of applicants that are very well qualified get actually accepted into MD schools. So that's a marker to say, look, if you just have the average for matriculants, people that get in, it's still not a for sure thing, right? 40% of people don't get in, even with those great scores. Now, let's drop down and say, maybe you struggle a little bit with your GPA and say you scored like 3.4, 3.5. That number all of a sudden drops by about 10%, down from 62% to 49%. Flip of a coin to get in. Let's say you didn't do so hot on your MCAT, and let's pull that 3.4 GPA over like a 503 MCAT. Now it's down to 25%, quarter of a chance to get into MD schools. It's exceedingly competitive for MD admissions, okay? Now, let's quickly compare. So we're saying like 503, 504 MCAT, which is honestly almost unacceptable to MD schools, 3.4, 3.5 GPA. For most people, and let me just get my screen out of here so you don't get too stuck on the numbers here, is that, okay, so if you come in with kind of these subpar scores, or at least less than the national matriculant average, for most people, if they come to me with those scores, I'm going to tell them you probably shouldn't even be applying to MD schools to begin with. It's just not a good use of your time. Look, if you want to, you can. I'm going to help people get their personal statement, working activities, letters of recommendation, make sure things are top notch. But shoot, do you really want to spend all that time, all that money, all that effort for a 25% chance? Shoot, not in my opinion. That being said, those numbers which give you a 25% chance of admission to MD schools, those are actually the average for DO schools. So I would tell you, hey, look, you should probably be looking really hard at DO schools. I would be applying to all DO schools, and you've got a pretty darn good chance of acceptance. And remember, these are just numbers, statistics, right? So maybe if you've got an impressive background, if you've got some other stuff, a great personal statement, a great application, a timely application, those numbers can only go up, right? And so most people overlooked the DO application for a couple of reasons. One, some of those misconceived notions about DO, some of the FAQ stuff that we talked about up front. They don't think they're going to get the same education. They don't think they're going to have the same opportunities, which remember doesn't exist. Or they're so caught up on, I just want to be an MD. And that's where I'm going to pause and ask you two questions, okay? For people that are applying right now, or anybody that's actually written their personal statement or thinking about their personal statement, let me ask you, does anything in your personal statement say anything about your long life desire to have the letters MD at the end of your name? Probably not, right? I'm guessing that your personal statement says things like you want to help people, that you care about people, that you want to bring your compassion and empathy and make a difference in the world. Shoot, I'm going to tell you, 10 years from now, you are not going to care what those two last letters are at the end of your name. If you're treating patients, making a difference in people's lives and practicing medicine, you're fulfilling your career and your passion, okay? So I tell people, look past those letters and understand with perspective that these things actually don't matter down the line. And ultimately, too, this whole discussion about like DO versus MD, and sometimes that discussion is DO versus MD or Caribbean schools, like this whole conversation about MDs and DOs only exists in basically like two places: SDN, Student Doctor Network, and Reddit. Okay? It only exists in like the pre-med world, okay? And I remember it because I was on those message boards all this time as a pre-med applicant and during my application. Actually, in medicine, nobody cares about the MD-DO thing. I work side by side with MDs and DOs, and nobody cares about it. We're just working hard to take care of people. So the next question I want to ask you, okay, so if we're talking about getting back to the basics of why you're applying, and if your goal is to get into medicine and actually do this, and you got a much better option with this DO option if your scores aren't too hot. So then brings about the second question, and I ask this to every single applicant I work with, okay? Imagine that you apply to MD schools and DO schools, all of them. And by the end of the cycle, you've been rejected from every single MD school, but you have an acceptance to a DO school. Do you take the acceptance and matriculate in the fall to the DO program and start to become a doctor? Or do you reject the acceptance and reapply, maybe take the MCAT again and start the whole process over for MD schools? Okay, there's no right answer to that question. although I kind of heavily lean towards taking that DO acceptance and moving on with your career. But everybody's got their own take on that, and that's okay, but you need to ask yourself that question. If the answer to the question is, I don't know, or maybe, you should definitely be applying to DO schools and then make the decision later. If the answer is, yes, I would definitely accept that DO application, the DO acceptance, you should be applying to DO schools. If the answer is, no, I will reject that acceptance, well, one, I would maybe taper your expectations and have a longer discussion. But number two is then don't apply to DO schools. It's a waste of your time. You shouldn't be spending your money applying to DO schools if you have no intention on accepting that acceptance. So that's a really difficult question to answer, and you may or may not have an answer to it, even just hearing it right now. But you should be thinking about it, and you should be asking yourself about it, because that's how you start this whole process of whether or not to apply to DO schools and how to do it right. So that was some pretty heavy stuff. But let me pause again and see if there's any questions so far.
So we do have a couple of questions, sir, just along with what you were talking about, the personal statement, which was great information. One of the key questions from one of our YouTube viewers was whether or not you discuss your desire to be in the Army in your application to medical school.
That's a good question. So for all HPSP people out there, do you talk about the Army? And another question that kind of piggybacks on that, because all applicants ask me this a lot, is, will it help my chances of acceptance if I bring up the fact that I have an Army scholarship? Almost to the degree of, I basically have guaranteed full funding. Does that help an admissions committee maybe think of me? No, they don't care. Okay, so one, it's not going to help you, so don't feel like you need to be compelled to be like, hey, I signed up for HPSP, I got a lot of money over here, I'm going to pay my bills. They don't care. Everybody that gets accepted is going to pay that tuition sum one way or another. So number one, it's not going to help you. It's not to your advantage. And number two, you got to remember is that not a lot of people know that much about HPSP. Not a lot of people know that much about Army medicine. And you may run into somebody that doesn't like the military or doesn't like that stuff. Okay. And this is a good opportunity to talk about this question, as well as anytime you're considering discussing something that might rub the reader the wrong way. Okay. So anything controversial, including potentially talking about the military, I would leave it off your application. Okay. It doesn't pose the opportunity to help you in any way, and it could, very unlikely, but it could rub one reader the wrong way and get your application tossed out. So if there's no advantage to it and there is a potential downfall, there's no reason to talk about the Army.
That's great feedback, sir. Thank you. Captain Windmiller has a question for you too, sir.
How you doing, Dr. Flick? Captain Windmiller, I'm the officer in charge at Culver City Medical Recruiting Station. I deal with a lot of med students and helping them get the HPSP and whatnot. And when I ask them about, well, have you applied for a DO school, sometimes they kind of give me the deer in the headlights look. But my real question is, you deal with a lot of med school students. What percentage do you think are DOs, and what percentage are MDs that you usually see apply to these med schools? Yeah, and then kind of why does it kind of fall that way?
Yeah, there's basically two types of applicants that are applying to DO schools. One is the applicant that probably had some significant exposure or interaction with osteopathy, and that's exactly what they want to do. Okay, they are all about the tenets of osteopathy. Their goal is to become an osteopathic physician. That's actually relatively rare because people just don't have a good experience, or not a good experience, they just don't have enough exposure to osteopathic medicine. And honestly, most people are driven, their understandings about medicine is really driven by television and media and stuff like that. Like, where do you see like people wearing a DO badge, like on some doctor show? Okay, so part of that is just, lack of exposure. So, and then the second kind of applicant is the one that knows very well these application statistics, and they're like, shoot, I've got a lower MCAT, I've got a lower GPA, I don't stand that hot of a chance at MD schools, I'm going to put my energy into DO schools. I don't have a very good answer about exactly what percentage of the people that I work with as pre-meds apply to DO, but what I will tell you is that if you don't have, let's say, even somebody with a 5.10 average MCAT, 3.7 GPA, I am still going to push them to apply to DO schools as a backup. Okay, especially after I ask them that question, right, about would you take that DO acceptance. So if they're open to the idea, I'm going to use that DO application as a backup. I can't tell you how powerful it is to be in October with a DO acceptance and still the rest of your application to move forward. It is a huge motivation to know I could just go to medical school at this. I could just push my whole application and decline everything else, and I'm set. It also helps you move forward with interviews too, with a big boost of confidence. I've got what it takes. Somebody likes me. They know I can make a good doctor. It's going to help you with your interviews too, kind of like a little confidence boost. So for most people, I'm going to tell them to apply to DO schools. I'd say my threshold is if you've got, and this is very subjective, right, because it depends on the applicant, the rest of their application, but if you got a 513, 3.8, I don't think you need to be applying to DO schools unless osteopathy is something you're really interested in. Anything lower than that, I'm going to strongly, strongly encourage at least 10 to 15 DO schools.
That makes a lot of sense. Thank you, Dr.
Cool. Other questions so far?
So one of our viewers asked, sir, if you have any tips that you could offer for the interview portion of the process.
Okay, cool. Well, congrats. If you're asking about interviews, then you're probably getting interviews or you got something lined up, which is great. And so we're sitting here in February, and it's a good, let me lower everybody's blood pressure real quick and say, like, this is not that late, okay? Interviews still extend into spring. I worked with somebody, one person I went to medical school with, they got accepted in June. They already had an apartment at in another state, and they got into UC Irvine. So acceptance does still come late. I mean, it is at the tail end of the application season, but hang on, there's still more to go. And so, sorry, I'm getting too advisey here, but if you are still waiting for an interview and the season's not over, any school that you have not heard from, you should be writing a letter of interest to them right now. So please listen to the rest of this, and then when we're done, go write your letter of interest and send it to every school. Okay, it's not too late. Okay, so you got an interview, tips that you got for it. So the number one tip for practicing for an interview is that you have to practice, okay? If you've never had a job, you definitely need to practice interviewing because you probably haven't done a lot of interviewing. But it doesn't matter because unless you are already in medical school, you've never successfully interviewed for medical school. And so you have to practice. You can go online, you can find tons of free resources, SDN, Reddit, Med School Coach. Just look for practice interview questions. There's YouTube videos, there's tons of resources that are for free so you can get an idea of what those questions are. I'll tell you just real quick that you must be prepared to answer at least these three questions very well. Tell me about yourself. Why do you want to go into medicine? And what are your greatest strengths and weaknesses? You're going to get those at every single interview, so make sure you drill those. But you need to practice. Practice in the mirror, practice on video, practice with a friend, practice with your recruiter, practice with your mom. Just practice with somebody, and you need to do it over and over and over again to get those nerves out. That's about as general of as advice I'd give out right now, besides going into like details on each question.
No, that's perfect. Thank you, sir.
Cool. I see one question on here we can address real quickly about maybe personal statement as it relates to people that are preparing for this cycle, and especially in relation to MD and DO schools. So the cool thing is that a couple years ago, there used to be a different character count between AA Commas, which is the DO application system, and AMCAS. They're the same now. So you can write the same block essay and you don't have to trim it down for a character count. The only difference is, excuse me, hang on. Sorry, I'm still getting over a sore throat. The only difference is that you must discuss why you want to go into osteopathic medicine in your DO application. Do not whatsoever copy paste your MD application and put it into AA Commas. It is not going to fly. Every single AdCom knows what that looks like, and they're just going to catch you. It's not a good look. So you're going to have to write a specific essay for it. It doesn't mean you got to rewrite your whole essay, but you either want to weave into your essay those tenets of osteopathic medicine to prove to the reader you know what osteopathic medicine is, or introduce a separate paragraph that addresses it. It's different for each person. Most people can get away with just a separate paragraph kind of slid in there. Don't make it your last one. That's going to obviously look like you just copy pasted and put it in there. So weave it in either a separate paragraph or try to build it into each paragraph, but you have to discuss it in that personal statement for DO schools. Cool. Other questions so far? Let's keep going.
I have a question if we have
please.
time. So I have an LOA to a DO school. I've kind of been in a similar boat that you kind of just described. Of I had an early acceptance, which gave me all the confidence in the right, and then
So cool.
I've just been smooth sailing since then. But what does some of the additional trainings that you have offered to you as an armed physician look like? Like, I know there are endless opportunities, but what are some that you'd be willing to speak about?
Yeah, good question. And so that's actually why I went into the Army, is that I'd spent a lot of time, about 2 years, actually kind of traveling through the world and seeing some places I wanted to go back to and provide medicine. Think about kind of difficult places like Southeast Asia, places that basically where I kind of thought rough areas that need really good medicine. And so that's why I joined the Army, because I didn't know what I was going to go into. I thought I was going to be a neurosurgeon. I ended up being a family physician. So I knew that whatever I went into, I would get that extra training to be able to practice in what the Army calls austere environments, okay? So whether you go into pediatrics or plastic surgery, every intern, that's actually after you finish your medical, your 4 years of medical school and you start your first year of internship, in that first year, you're going to go to a cool course called Combat Casualty Care Course, or C4, and you're going to learn how to practice austere medicine. Mass casualty events, trauma, all sorts of really cool stuff that basically empower you to do that kind of medicine. It was actually a really cool experience to leave that and then come back into my civilian job and feel like if I ran across a serious car accident or some kind of trauma, I'm totally equipped to handle that, even as a first-year family medicine resident. It's a really cool feeling. The Army does an exceptional job at doing that training. Everybody gets that. And then if you actually deploy later on, they're going to send you to a refresher course that is pretty similar to that. I think it's about a 10-day course. And you're going to learn some of those similar skills that you're talking about: emergency intubation, cricothyrotomy, basically how to insert an emergency airway, chest tube placement, trauma care, how you can manage mass exsanguination, hemorrhaging, all sorts of intense trauma stuff that empower you to be able to take care of pretty much any situation you get thrown at. It is a huge boon to me as a rural medicine doctor, is that I'm way out, I don't have a ton of resources, but I'm super well trained. I feel like I can handle anything that comes in the door. Plus I got a good sense of where my left and right limits are, so that I know when to refer and what I can handle. It's really cool training.
Thanks for that.
Welcome. Congrats on the acceptance. Make sure you spend this summer not doing medical stuff and just relaxing, because you got a heavy 4 years ahead of you.
I will. Thanks.
Okay. Let me circle back to just a couple of things too, to make sure I kind of hit the points I wanted to talk about. We're about 38 minutes into this. We still got some time to. We talked about what's an osteopathic physician, who should be applying to osteopathic medicine. We kind of talked a little bit about how there really are no practical differences in terms of practicing medicine, opportunities in the Army. I do want to just really quickly address something about opportunities in residency. So I'm an associate director of pre-med advising with my company. I'm also the director of residency advising. So I actually work with medical students applying to residency, a ton of DOs, okay? And they come to me asking, well, what can I do? And am I going to be a competitive applicant? And again, I'm sorry, I'm like a broken record now, but it's your performance in medical school that makes the difference, right? It's not those 2 letters. It's not where you went to school. And what's exceptionally different about this past couple of years is that there used to be 2 different types of residency: DO residency, MD residency. This past year, they finally combined, okay? It's a single accreditation system. So DOs go to the same programs as MDs and vice versa. It's all together now. So that should be a huge burden lifted off DO applicants and DO students, is that you now have literal full access to all the same stuff that MDs do. So it's very exciting that they kind of got rid of that barrier. Over the next 5 or so years, you're going to see those barriers disappear more and more and more. And so in terms of proceeding on through residency, no worries for DOs there. Okay, maybe I want to hit some other questions too that got sent to me, but as I'm pulling up these, quick pause to see if there's anything else from the crowd. I'm kind of taking a look at the chat here. I think we hit everything. Personal statement, DO applicants, but interview stuff.
Hey, sir, I got a question that I got someone text me to ask. What she wanted to know is, is there a difference in the patient population that you see on active duty and in the civilian sector? Do you also feel that you see more patients in the civilian sector versus active duty?
That's a very astute question and pretty far-reaching too. It's not pretty common for pre-meds to be thinking about that kind of stuff. So good on you for asking that question. And yes, there is a pretty big difference, but kind of, and how that matters is important too. So, okay, let's talk about residency first, okay? So remember, during medical school, you're doing everything else that your peers are doing. Even if you're at USHIS as active duty, you're still you're working in a civilian hospital too. So you're gonna see the same stuff at USHIS as HPSP, that's all the same. So really what we're talking about is residency to begin with. Is your residency exposure gonna be typical or comparable to civilian? The answer is yes and no, and there's a caveat there. You're gonna be training at, most likely, 99%, you're gonna be training at a military institution that serves both active duty, reservists, and all those. So military folks and their dependents, so civilians too. So you're gonna get exposure to some soldiers or airman or whatever branch you're in, plus civilian, which is gonna be balanced. So you get a little bit of both. If the program that you're at does not have an adequate population, they will send you somewhere else, okay? They're very good at that. That's true of my colleagues. I trained in Hawaii, which was not a big trauma center. And so my colleagues that were in general surgery, they got shipped off to LA to go work downtown LA at USC. And so they get a lot of trauma experience there, right? And so your program is gonna take good care of you. Remember, your program director is gonna be a military person, but they're physicians just like you. And they're gonna be looking to make sure that you get the absolute best education that you get. Now, when you get out of your residency, that's highly dependent on the specialty and the type of medicine that you practice afterwards, okay? So this is more true of primary care than other specialties. Look, if you're an anesthesiologist, you're gonna be working in a hospital, you're gonna be working in the OR, you're gonna be basically doing the same thing that your peers do. There's a little bit of discrepancy in primary care because people like me, family medicine, we can go work in a hospital, we can go work in a clinic, or we can do operational medicine, which is go work with a unit. And that's what I did. I became a flight surgeon, work with an aviation unit. That's gonna be very different, okay? In an aviation unit, I'm taking mostly care of healthy 18 to 40-year-old people because that's kind of just specific to the nature of that training. You don't have to do that, but if you want to, you can. And so your patient population will be dependent on what type of job you choose. That being said, I was quite cognizant of the fact that my population was different than what my peers were training for. And in the eventual, I mean, everybody gets out of the Army somehow, right? You're either gonna leave after your commitment's done, you're gonna retire, you're gonna do the whole thing. But when you leave, I wanted to be prepared to treat everybody. So I did a little moonlighting at an urgent care, basically worked a couple hours. I'd take some days off and just go get some practice to make sure I was keeping up my skills. So it's a very good question because basically what you're getting at is I'm gonna be prepared to take care of military folks, but will I be prepared to live life outside of medicine? And the answer is yes, you're gonna have those opportunities. Very good question.
Sir, I believe Sean has a question for you regarding residencies a little more specifically.
Yeah, shoot.
Yes, sir. So my question is about now, since performance is so important, how your performance in medical school, dictates, potential, spots for residency. Now, we had been introduced by our dean of the school. They had talked about, since now those programs are intertwined, the residencies, excuse me, are now, the same. How does that reflect on MDs taking USMLE versus DOs taking COMLEX? And they did recommend to us that you might, depending on your specialty of interest, take both, COMLEX and USMLE. I wanted to hear what your take was on that, or if you think, someone will still be competitive, just taking one versus the other.
Okay, another good question, and definitely right. This is like my bread and butter as the director of our residency advising division. Okay, like nothing stresses out DO students more than USMLE and COMLEX. And so let me just provide some context for everybody else listening out there, is that the accreditation for residency is the same, the licensing is different, okay? And so as you go through medical school, you take a bunch of horrible, terrible tests, and they give you your license to practice, right? And so in the MD realm, it's called USMLE, United States Medical Licensing Exam. And then in the DO world, it's COMLEX, and I don't remember what COMLEX stands for, but something about DO licensing. So they take two different tests. Now, no MD is ever going to take COMLEX. They'll never pass it because it has to do with osteopathic stuff. But DOs will often take USMLE to gain a competitive edge to applying to residencies. This was very true when residencies were separate, right? If you're a DO, you cannot apply to an MD residency without taking USMLE. They don't know what a COMLEX score means, and they don't know how to compare it to USMLE. That is disappearing, and it's in the works of disappearing. Now, if you're super nerdy and you're keeping up on what's going on with USMLE, you may know that they broke everybody's heart this year, and they made USMLE, which is the most important stressful exam of your life, they made it pass-fail. And all the old timers got really upset, like, I had to take a test that was scored and it was horrible. And all the medical students are like, yay, this test that was killing us is finally a little bit less stressful. And there's plenty of stuff in between. But COMLEX is likely to change as well in the future. When that's going to happen, I don't know, but I wouldn't be surprised if they change to pass-fail. But the bottom line is, and sorry, there's a lot of details behind this that I could talk to you about forever, is that it's very nuanced. The reasons that a DO should take the USMLE are very, very nuanced. But I'll tell you just in a nutshell is that this is actually a competitive advantage for DO applicants. If an MD bombs the USMLE, tough luck. You can't take it again. You're stuck with that score. If a DO bombs their COMLEX, you could take the USMLE and impress your residency program by taking another test that they know about. It's actually a really cool advantage. So the only time I'll tell a DO to consider taking USMLE is, one, you bombed your COMLEX and you need to remake yourself, or two, if it's an ultra competitive specialty thing like plastics, derm, you might consider taking it to just get a competitive edge if you're applying to a, like a high tier school, think like Harvard derm, okay, you might want to take it. But that all being said, I want you to forget that I said anything about those tests, and I don't want you to think about USMLE or COMLEX for like another 2 years, okay? Life is stressful enough. I mean, it's good to ask these questions, don't get me wrong, but like, don't worry too much about that stuff for now. I know it's super stressful to think about it. Don't be looking on SDN about USMLE and COMLEX and stuff. Just give it a break for a second. The reason that USMLE made that test pass-fail is that they recognized something happened called a parallel curriculum. Medical students were studying for their medical school exams, and they were studying for their USMLE, and they were burning the candle at both ends, and they were stressing and burning themselves out. USMLE decided to make that pass-fail so they would just focus on learning medicine. Whether or not that's going to happen is a whole nother story, but so hopefully that gives you more than enough context than you're probably looking for, but please don't stay up late nights like stressing about COMLEX and USMLE yet.
Thank you so much for that extended response. It's really shed some light, and I appreciate it. So thank you.
For sure.
Hi again. My question, I guess, is just a little bit more general about if you'd be willing to talk about either the differences or similarities between the military residency match versus the civilian residency match, and kind of as an HPSP recipient, which one either you took or which one is more preferable? Yeah,
good question. So if you're an HPSP applicant, you will be participating in the military match. It's required. You must rank all programs in your specialty, okay? Okay, recruiters, don't get too upset with me right now. I'm gonna go off the book a little bit here, right? Okay, so recruiters often may talk about if you don't get, well, they may say that, hey, you could get a civilian residency. Okay, that is absolutely true. As an HPSP applicant, you could get a civilian deferment and go train at a civilian institution. That's true, and yet it's not very common. And so for expectation management, when anytime I talk with an applicant, I say forget about it. Don't think about that. I don't want you to hold this thing that the recruiter told me and then end up being disappointed when you end up in a military program. Because what they're saying is true, and it is useful, because let's say you go into a specialty. I don't want to get too deep into this, but basically the reason that you would get a civilian deferment is that the Surgeon General projects they need more of that specialty than the military has available slots. And I'll tell you what, the military is very good at predicting that, which means it's usually pretty darn close. And so, for example, in my HPSP total cohort, I think there were like 2 civilian deferments. Okay, so it's practical to consider. I just don't want people to get hooked on, like, I'm going to go HPSP and then I'm going to go into a civilian deferment at UCLA, and then they find out that doesn't happen and they say, darn it, you know, the Army lied to me, the recruiter lied to me, like that. I just want to set expectations. So sorry that was long, but okay, the military match is a little bit different. Okay, you're going to still apply through the same thing. Don't worry about any of these names for right now, but just like you use AMCAS to apply to medical school, there's something called ERAS, Electronic Residency Application System, for applying to residencies. It's just like AMCAS, but it's a lot shorter. So just like all your civilian peers, you're going to go sign up for ERAS. You're going to do a personal statement, your work activities section, letters of recommendation, you know the drill. The difference is that the civilian world uses something called NRMP, National Residency Matching Program, which is some kind of fancy magical algorithm that stresses everybody out, and basically a computer pairs programs to applicants. The Army doesn't work like that. The military doesn't work like that. They actually use people. And so you're going to apply to programs, and you're going to rank your programs, and the programs are going to rank the applicants, and then they're going to bring that stuff together, and they're going to have a discussion in Washington. The Joint Chiefs are all going to meet, and they're going to talk about who's going to go to what program. That's kind of reassuring to me that there's actually people looking at it instead of an algorithm that sorts you. The cool thing about it is that you actually do this thing in December, okay? So in your 4th year of medical school, you're going to be applying. That's when you start your application process. Then you're going to match at the end of the year. Super cool, because that means you start your last 6 months of medical school and you already got your residency position. Your peers have to wait till March till match day, which is cool. So you're going to match a little bit earlier. The process is generally the same, okay? You're applying to programs, you're ranking the programs are ranking you. The only difference is that people are actually doing that matching and pairing up and trading and talking, rather than submitting to an algorithm and then it just sorts back and forth.
Sir, do you think that that probably is why the match process or the match percentage is such a higher rate for our students as it is for the civilian sector?
I'll give you my opinion. I don't have any data to back this up. My opinion why the military match is so good is it's a no-fail system. And this is actually super important. Let's say that medical school does not go the way you planned, okay? Now remember, I've been stressing and repeating that performance is everything, right? And let's say your performance takes a dive for whatever reason. Okay, in the civilian world, you can get in really big trouble. Is that if you don't have a competitive application, it's possible that you could not match. Remember, it's just an algorithm sorting people. If you're not competitive, let's say you don't even interview at any program, you're not going to match. What happens to a medical student that passes medical school but doesn't match? They can't do anything. You don't get to practice medicine with just half a license. You actually have to finish your intern year to get the 3rd piece of your license to practice. And plus, it's pretty hard to practice medicine with a license and no board certification. You don't have a lot of training. There's a lot of people that get stuck, and there's a lot of articles written about this huge pool of people that are trained fully through medical school but then can't practice medicine. That cannot and does not happen in the military, because they have enough slots, okay? They only take enough people into HPSP to fit them with a program. You may not match into the residency that you desire, okay? Let's say you're not competitive to begin with, and you go out on a limb and apply to Durham, you're not gonna get in, okay? You're not gonna match. But the Army is gonna be able to give you a transitional year, a preliminary year. They're gonna give you an internship. That is huge. Number one, that means that you get training. That means that you get a license. And plus, it means you get your foot in the door to a military training hospital. You can make connections. There's tons and tons and tons of transitional years that then end up joining a residency after that year, and they get into a full residency program to get board certified. That is so, so important. So my opinion, and again, I don't have any data to back it up, is because the Army and the military plan so well for this in advance that they make sure their applicants are taken care of and do match into something so that they can practice medicine. Very good question. Okay, we're about 55 minutes and I'm wrapping up a little bit. I'm just gonna read through some of these questions, see if there's anything out there, but while I'm taking a look at some of these, if you guys got anything else, please drop them my way.
I do have a couple of housekeeping notes, sir, while you're kind of reviewing that.
Very good, please.
We have a couple of really great events coming up next week for folks to take advantage of. With all this information that we received from you today, Dr. Flick, we are also hosting Colonel Christopher Meyering next week on our YouTube channel, Sick Call. Colonel Meyering is going to discuss DO a little more in depth in his experience in the Army. He's currently the command surgeon for U.S. Army TRADOC and Doctrine Command. So it should be a great opportunity to kind of hear about his path as a DO in some more of these leadership type style roles while practicing. In addition to that, we are also hosting a virtual career fair on the 25th of February, and that is going to be geared more towards the students. So if you've got questions, there will be recruiters live to answer questions about HPSP, for example, since we talked about it today in length, but also other programs that we offer like the PT Baylor program or some of our dietary programs for nutrition. So there's another great opportunity for folks to kind of take advantage of. But we want to thank you, sir, for any of that. Were there any other questions that we maybe missed?
I think we hit everything. I'm going to just in 30 seconds talk about this last question is, well, shoot, you sold the idea of DO schools. Man, I should have applied to DO schools and it's February. Should I try to apply now? The answer is no, is that it's not like you just click a button. You still got to put together the whole application, letters of recommendation. It's a bit late for right now. So if all that stuff jive with you well, and that sounds like a good option for you for osteopathy, start now, put together your application for next cycle, do it right, and do it well. Otherwise, that's all I got. Thank you guys so much for having me. It's fun.
Of course, as always, we like having you. Sorry, go ahead, sir, Jonathan.
Yeah, we want to thank you, sir, for taking out your time today and doing this. This was very, very, very informative. We had a lot of engagement online. A lot of people texting me, asking questions. So I know that we definitely made an impact. And, from the LA Medical Recruiting Company, we want to give you a great, great, huge thank you and a shout out. And hopefully we can do some more stuff like this again. Try to catch it a little bit earlier in the year next time. Yeah. But again, sir, we thank you so much for blessing us with this knowledge and everything that you taught and gave us today.
Oh, you're most welcome. Congrats to Sean and Alexandria for your letters of acceptance. I'm stoked for you guys.
Thank you, Dr. Flake.
Thank you.
Thank you so much.
Well, that, without further ado, wraps up another episode of Sick Call. Thank you, sir, again, and everybody else. Enjoy your weekends, and we hope to see you again next week.
Bye-bye.